Well, good afternoon. I know that everyone is always very keen for me to kind of cut to the chase and get to the point very quickly. But before I do so, I just want to remind you of three things to really set the scene, I guess, for our decision making. Firstly, the very fact that this briefing has actually been moved from Friday to Wednesday means absolutely nothing. When we stopped the weekly briefings, we said that we would hold them really as and when we needed them. And of course, the last one on the 24th of July, I also said that we would let you know just as soon as we had made another decision. And that is, of course, exactly what we are now doing. Secondly, it's to remind everyone that Guernsey's normality is not the normality enjoyed by, really most of the rest of the world. We are enjoying a sort of gilded existence, and it is against that backdrop that we are making decisions about how to reconnect with the outside world. Of course, frankly, we never expected to eliminate the virus and to be COVID-free so quickly, and the fact that we are has, of course, enabled normal economic, school, community and family life to resume, or at least, of course, for the vast majority of the population and business. And when we talk about wanting to protect the gains made, it is frankly, it's this way of life that we want to maintain. And as we've said many times before, we do expect more COVID cases at some point. And when they do come, we will be prepared, and we do expect to be able to manage them whilst remaining in our phase 5 way of life. And of course, if we do have to reimpose any restrictions, we would expect to be able to do that in a targeted way rather than, if you like, scuttling right back to a full phase 1 style lockdown. Thirdly, we've said all along that we must be flexible to a rapidly evolving situation, which of course this has been really right from the 1st of January this year. On the 10th of July, I said two things. I said firstly that we would be concentrating our planning on moving to phase 6, hopefully from the 1st of September. And in the meantime, we would not be extending the 7-day self-isolation and test trial. Now, a lot has changed since the 10th of July with the deteriorating position in hotspots around the UK, Europe and the world. And of course, as the situation has changed, so has our thinking and planning. The Civil Contingencies Authority has decided that we must continue to plan and resource up so that when the time is right, we can move quickly, very quickly, to unquarantined travel. But we've also decided that we cannot at this point set a date for that. So for those hoping for confirmation today of unquarantined travel from the 1st of September, they will be disappointed. However, we have decided to move to a 7-day self-isolation with a test on day 7 with effect from Monday the 17th of August. And following receipt of a negative result, an individual will then be released from self-isolation into a period of what we're terming passive follow-up, which Deputy Salisbury and Dr. Brink will explain in a moment. And this is less restrictive than that which existed during the trial period. The development of this protocol has been informed by new evidence, which has strengthened our own public health team's analysis of the risks and the efficacy and the effectiveness of the regime that we are scoping and producing. And again, Dr. Brink and Heidi will explain this more in the presentation in a moment. But in short, the Civil Contingencies Authority are satisfied that it is safe to move to this regime from the 17th of August. And this will apply to passengers arriving into Guernsey or transiting to Sark from that date, and the 1st of September for passengers transiting to Alderney, and that's at the request of the States of Alderney. And we will be liaising, or we are liaising, I should say, with the transport operators to ensure that passenger numbers do not exceed our current our current testing capacity. As you know, we're increasing our testing capacity, but our current testing capacity of around 600 a day, taking into account the priority which Nikki has often highlighted, of course, for testing of symptomatic cases on island and pre-operative testing in the hospital. I should also say that we remain in very close dialogue, both at public health level and at a political level, with colleagues in the Isle of Man, and I'm speaking to my opposite number weekly. They are aware of this change and are happy that it does not imperil the air bridge between the two islands, and they have confirmed that they too are looking at introducing a similar regime. We've also decided to reintroduce the concept of A and B countries, and we've added C countries too. A countries are those of highest risk, and anyone who has been in such an area within the last 14 days will need to self-isolate for 14 days on arrival into the Bailiwick. Those arriving from B countries will have the option to take 7 days self-isolation and a test on day 7, as I've said earlier. And those arriving from C countries, of which I should say the Isle of Man is the only one at the moment, can travel without restriction, and Heidi and Nikki will speak more about this in a moment. Finally, we are redefining the phases in the exit framework to reflect these decisions. So we're calling where we are, in other words 14 days self-isolation, phase 5A. The 7-day self-isolation and test regime will be phase 5B. An unquarantined regime will be phase 5C, and a complete return to pre-COVID travel norms would then be phase 6. And doing it in this way will allow us to introduce further phases if we need to, if it's appropriate as the situation continues to develop around the world, and also allows us to move back through phases 2 with any adaptive triggers that, of course, we've talked about in the context of the exit framework so often. And Paul will speak in a moment a little bit more about those different phases. So that's enough from me. I'm going to hand over to Heidi and Nikki. So Heidi.
Thanks, Gavin. As everybody will see, Nikki and I are going to be doing our double act again, but as different from the last time we did it, we can now bunch up, close up, because we can. And we will. So over to Nikki if you want to start, please.
So thank you. So to start off with, just to remind you about our exit from transition. So I think it's important, we've got our 4 aspects of the exit from transmission that we use all the time. So the first is our test, trace and quarantine. Really, really important. Our test, track and quarantine, really, really important. We know that's served us well in the past, and it will remain a mainstay of what we can do. Our robot is due for delivery in a few weeks' time, and we've also increased our amplification technology that we can use as well. So we continue pushing that forward to look at how many samples we can process on island. Really important for us. The adaptive triggering I've spoken about on so many occasions. So the adaptive triggering is how we go forward and back. And I think the really important thing is that even if we saw a case or even a cluster of cases on the island, that wouldn't necessarily mean that we went back. So it would only be if there were issues of concern that we felt that we were unable to cope with through the test, track and trace program. So I think that's important. So we'll be very responsive and adaptive when we look at how we manage any case that we might see. We've also talked about the phased release, and what we're doing now in phase 5 is essentially a part of the phased release. So we're looking at how we can move slowly forward through the phases to make it as safe as possible. And finally, our expanded testing program. So again, what I've said was we've got our further equipment arriving on the island, but we're also continually looking at the technology we use and how we can push that forward. We're looking at samples we can use, we're looking at pooling, we're looking at what targets in the virus we should use, particularly going into the winter season. We're looking at whether we should combine flu and COVID-19 testing in winter. So all of those things we're looking at as we push forward.
Nikki, I think the important thing to point out here is we really mustn't lose the gains that we've achieved through lockdown and through that really great progression, as I have said before, that how we've managed to canter through the phases. But we've done that by taking a risk-based approach and balancing risks. It's not been a zero-risk approach, it's been balancing those risks. Things went far better than we could have possibly imagined, so we've ended up being COVID-free. But that just meant we've also got no on-island restrictions anymore. And I think it's easy to forget how lucky we are compared with the rest of the world when, to all intents and purposes, unless we want to go off island, everything is almost back to normal for many and most people. But we really need to remember that we've only got that because of the strong controls we've got on our borders. And as things stand, as Gavin alluded to earlier, we're seeing increased cases across the world. Even in the UK, they've got hotspots. We're seeing like spikes in Brittany. We're hearing about around the world things are not dying down. And so the borders are still so important to us in being able to manage any potential increase, any infections coming to the island. But what we can do is look at any new evidence, and see what we can do differently now. We haven't just been saying, right, we're sticking to 14 days self-isolation. We have been saying, what is the evidence out there to enable us to do things differently? And so that's where we are at the moment.
Thank you. And then when we look at the backbone, as I said, it's our test, trace and quarantine. I think what's important from that perspective, you might have seen in the national news, information about how many contacts per case are being tracked. Now, we looked at that because I was asked about it through the national media yesterday, and in fact, we get in excess of 95% of contacts per case, so that way exceeds what's happening in other jurisdictions. So I think that's really important, so that really effective contact tracing has always been central to our response. And I was asked last night about how we achieve it, and one of the things we do when we had a case, we'd immediately establish a rapport with that case. So when we spoke to them, we'd find out how they are, find out if they needed anything, explain why we were contact tracing. And this really became part of the Guernsey Together response, so people became really interested in helping us. We explained how it would protect the whole community. So it was that community spirit that helped so much with our contact tracing and helped us achieve those very, very high levels of contacting contacts. So you've all seen this picture again, but I think this is but I think this is central to the designing of our strategy. So if you look at scenario one is a traveller who was infected before travel. So what you can see from that is if you test that person on day one, you will indeed find most of those to be positive for the virus. Scenario two is a person that is infected during travel. If you look at that scenario, if you test that person on day one, you will miss 100% of cases infected during travel. So that's been critical to how we model any test mitigation in our borders. So when we did our initial modelling of scenario two, what we showed is that 81% of cases could be detected by day 7 of travel. And we were absolutely delighted, not this weekend, but last weekend, when a study was produced from a very, very large London hospital looking at exactly what we looked at, a border modelling, but also going a little bit further back to the tail end of people that were infected prior to travel. And what they showed in that study is that 94% of people could be detected on day 7 if you tested them on day 7. So this has been critical to how we look at the future modelling of our borders. So if we then hand over to Heidi to just look at the initial relaxation that we've done.
Yeah, this is basically what we now call phase 5A, and this is what we've got at the moment. So I mentioned a couple of weeks ago about healthcare, critical healthcare and compassionate travel. We are actually now expanding that. So from immediately, we're bringing in the 7-day self-isolation and 7-day test, which is what we're proposing for the rest of the population on the 17th of August for that. So that can be brought in immediately. We've also got the business tunnels, and those have been used, and that's through, I think, the UK and Jersey. And we've got the air bridge, and currently just the one air bridge with the Isle of Man. And on that front, I'm really pleased to say that we've now agreed in principle a reciprocal health agreement with the Isle of Man. We just need to dot the I's and cross the T's, but that should happen, any day now, if not tomorrow, early next week. Basically, that'll enable free emergency care for those visitors to the Isle of Man and visitors from the Isle of Man to here. Won't include cost of GPs, dentists, ambulances, but it will include free air ambulance to the UK if somebody needs advanced treatment in the UK. We are also resuming negotiations with the UK after all the COVID issues, as people can imagine. That might take much longer. We will have to see how that goes, but at least I'm very pleased that we've been able to work very swiftly and at pace, at COVID speed, with the Isle of Man. So that was good news.
It was good news, yes. And with the critical travel, what we felt it was really important to do is to respond to everything very quickly. And when this data came out, we didn't want to wait till the 17th of August for this particular group. We felt it was only right that we introduced that straight away. So one of the things that we've spoken about in detail is the reinstatement of Group A, B, and the introduction of Group C countries. Now, most of you will be familiar with what we did going into lockdown, where we had our Group A and Group B countries, and we feel that it's appropriate to introduce that again as we look at risk mitigation on our borders. So Group A countries are countries that we think are at a particularly high risk, and for anyone travelling from a Group A country or indeed transiting through a Group A country, we'd expect them to do 2 weeks of compulsory self-isolation. So really important from that perspective. A Group B country are countries that are at less risk, and what we will be doing is publishing our exact criteria, and I won't go into detail now, but our exact criteria of how we're classifying someone as a Group B country, and that basis is based on the prevalence per 100,000. So we're looking at a variety of sources for that, the European Centre for Disease Prevention and Control being one, Public Health England being another, and various global programs as well. And we're looking at the prevalence of infection per 100,000, but looking at other issues, for example, the testing rates, because if you don't test, you aren't going to get any positives. Looking at other public health issues of concern within that jurisdiction. So all of that forms the basis of us classifying our Group B countries. So with someone coming from a Group B country, they have two options. They can either self-isolate for 14 days if they don't want to be tested, or alternatively, they can come into the country, they can self-isolate for 14 days, have a test self-isolate for 7 days, have a test on day 7, and on the receipt of a negative result from that day 7 test, they can then go into passive surveillance. So one of the feedbacks that I had from passive surveillance in the pilot was it was quite restrictive, and we really felt that we needed to review that in light of the data coming out from the London School of Tropical Medicine and Hygiene saying that you can get 94% of cases on day 7. So what we've done here is we've made the passive surveillance or passive follow-up far less restrictive. So it'll basically include reporting if you have any symptoms of COVID, going for testing, so low threshold to report symptoms and seek testing, and then also restrictions on visiting hospitals, visiting care and residential homes, because those are obviously vulnerable places. We said that if people have to visit hospitals for appointments and so on, obviously on an emergency, obviously that needs to be done, but you just notify ahead that you are in a period of passive surveillance. So very, very light but very sensible restrictions. People can go to work. We've asked them again to have a low threshold to self-isolate if they develop any symptoms. So really common sense approach. And the feedback that I've had from people from this pilot is that would make a huge difference. So I think it's important to respond to any feedback that we get. So anyone travelling to a Group C country, as Deputy St Pierre said, the Isle of Man being the only one in that group at the moment, will be exempt from any testing requirements and all self-isolation requirements. So really important from that perspective. So the reinstatement of the Group E, A, B and C countries, I think it's important to emphasise here is that they are subject to change at short notice, and people must be aware that if a situation changes in a country, we may have to change the categorisation of that country. What we've done within the Group B, and you'll see when we publish the list, we've put a group of countries which we think are okay to be in Group B, but perhaps the rates are going up quite fast, or they're just on the edge of fulfilling Group B criteria. And for that group, we've included a warning, so that these might change at shorter notice. So I think that's really important. What we want to do is provide people with the appropriate data and the appropriate information so that they are able to make the right decisions for themselves. Now, there are separate arrangements can be made for Alderney and Sark, and we will always seek advice and information from Alderney and Sark to see what protocols and what arrangements they would like made for them.
Just to say, I think from an Alderney's point of view, they're not taking part in the 7-day tests and 7-day self-isolation, 7-day tests until the 1st of September, but SARC are happy to follow the same time scales as us.
And we'll obviously work with all of the islands to find protocols that are acceptable to them. So the border control options that we've now come up with is a staggered approach. So we're currently in Phase 5A. So we've moved from Phase 5 into Phase 5A, which has some relaxation on our border controls. And that includes things like, as I say, the business tunnels, as Deputy Salisbury said, the critical travel, the air bridges and so on. At the moment, we're still in the 2-week compulsory self-isolation, other than the exceptions that I've mentioned. If we move to 5B, we're looking at the reinstatement of the Group A, B and C countries. And as I said, we're looking at isolation till day 7, test on day 7, and release on a negative result to passive surveillance or follow-up until day 14. Moving on to Phase C, 5C, what we're then looking at is further reduction in the restrictions post-travelling. So we'll be looking at reduction of quarantine times, perhaps putting more testing points in. So that is under development, and when that will start is still under review. So I think that's really important, because that will be travel where people will have no or very limited periods of self-isolation. So the border arrangement with the effect of the 17th of August is, as I've said, we've got self-isolation, a test on day 7. A person can choose to self-isolate for 14 days if they don't want to test on day 7. And you'll be released from self-isolation on the receipt of a negative result on day 7. And then, as I say, stay in passive follow-up. So really, hopefully, far less restrictive than our current procedures. So I've already alluded to what passive follow-up looks like, reporting symptoms consistent with COVID-19, make contact with the relevant health and care service if you need help and support, don't visit hospitals unless it's for emergency, and don't visit care and residential homes. And this is all about protecting the most vulnerable in our community. So really important that we're still very mindful of that. So forward planning to September, are you going to talk about that?
Yeah, I'm happy to. So we've got no time planned for either moving to 5C or 6. I think as made very clear by Gavin earlier, the time, things are changing all around us. To be able to set a date and then say, well, sorry, we can't do it now, it's not fair on anybody to do that. We've got to know that when we do something, it's the right time to do it. But what we are doing is working up what we could do for 5C, and then when, and always considering when Phase 6 will be appropriate. But I think, and as Gavin said as well, we might end up with a Phase 5D, E, F. It's depending on what we can do, what the evidence tells us, and what else comes out the woodwork as well. Because, as I say, it's such a fast-changing thing, this. I mean, we've learnt so much about something we never even heard of since the beginning of the year. And there's a lot of changes happening. There's a lot of tests going on. There's lots of more information about how the virus works and what's happening to it. It would be daft just to set a timeline for the next few months. So that's what we're doing now is yes, things haven't stopped here. I know it looks kind of like, well, we're back to normal from a daily point of view, but really there's a lot of work going on, particularly with Nikki and her team.
So We've got a number of things we're planning for now. So we're planning, I think you all know how I love to plan and I love to look at evidence. We all know that. But what we're planning for is we're planning for the return of a single case, and we shouldn't see that as a failure. We should see that as a success and that we've actually detected the case. We're planning for the return of a cluster of cases. And again, that's important. If we see a cluster of cases, we might not necessarily go back. But if we have 20 clusters of cases around the island, we might view that differently. So really important. We've also started on our winter planning. So that's really important because that's not only looking at COVID-19 and the possible resurgence of COVID-19 over the winter months, it's looking at whether we'd see increased flu activity. It's looking at the flu immunisation programs. It's looking at how we can protect and keep our population healthy over the winter months. So it's looking at a whole number of things. We're also planning or looking at a possibility of a second wave. So that's really important. For example, one of the planning things that we've done recently is we reviewed all of our contact tracing policies. And that's been really important because we've wanted to see what we're doing. Is there any new evidence that we should be including and so on. So we're continually looking to push and improve our policies to make sure that we're as prepared as we can do. And then we're also preparing for a mass vaccination program. Now, that's in relation to COVID-19. Now, we're not sure whether we'll get 35,000 doses of vaccine together or whether we'll get it in a stepwise form. So we've got to be prepared to receive both a large quantity of vaccine and plan how we administer it, but also plan how we would administer perhaps if we receive 5,000-6,000 doses a month over a period of 3 or 4 months. So we've got to plan for both scenarios. And I think that's really important. But you had more on the vaccination programme.
Yeah, thanks, Nikki. I mean, but I'm sure everybody's been listening to the news and the seeing where we're going in terms of a vaccine, and we hear about Imperial College and other Oxford University working away feverishly to get a vaccine, but we also know that things are being moved at pace. So things that would have taken years to do are being done in the space of a few months. Now, that might be rushed, but I think it's important for people to understand that doesn't mean shortcuts are being taken. But because it's being rushed, it means that all the full licensing approvals through the MHRA will not be there. If we want the vaccine and we want to be able to vaccinate people, it's highly unlikely that vaccine will have full licensing when it becomes available. So that means from our point of view, we need to look at our legislation because currently it won't allow us to use such a vaccine as things stand. So from an HSC point of view, and this morning we discussed this, a draft policy letter that we are wanting to take to the States urgently for the next States meeting to look at how we can change our current law through an ordinance to make that happen. Now, that is different from saying we're going to use this vaccine and that's what's going to happen. All it is about is making sure that the law is not a barrier to us being able to have a vaccine that comes along which is shown to be suitable to deal with COVID.
Yeah. Thank you very much.
Great, thank you very much. Paul.
Thank you. As noted by Deputy St Pierre, the announcement today doesn't take us to phase 6, but it does bring us closer. There is a good deal of debate, particularly on social media, about when we will be opening borders. There is, of course, movement through our borders, but there are measures in place to ensure the movement of people through our borders today operates safely. Reiterating the points made by the panel today, while we are not yet at phase 6 with unrestricted travel, the progressive steps within phase 5 ensure we will continue to move safely in the right direction. We are breathing life into our economy and spending our money at home. Move too quickly and we risk going backwards, as seen in an increasing number of places around the world. It is important to remember that we opened our schools towards the end of last term, something not achieved in many jurisdictions, and the intent, of course, is to be fully open at the beginning of the new school term. We can visit loved ones in care homes and in hospitals, go to bars, restaurants and shops, and enjoy gathering on a scale not seen in many other jurisdictions. So as announced on the 17th of August, we moved to 5B and a shorter quarantine period of 7 days, using what we learnt in the pilot scheme. As I previously mentioned, our process for managing that and ensuring that we are testing those that we need to will remain mostly manual at this stage. This isn't ideal, and behind the scenes we're working hard on a new bespoke IT system which will automate this for us. That will help us deal with the increasing numbers of expected when we get to the point when we can relax the quarantine period further in phase 5C, and importantly, tracking data flows to capture critical data such as where individuals have travelled from, including where relevant prior to the UK to Guernsey leg of their journey, not only in identifying an A and B list country, but what region they came from within that country. I was asked at the last press briefing if operationally we have the resources to deliver changes in our travel restrictions, and my answer was yes, it still is, but that doesn't mean those resources aren't under pressure, and we're having to look very hard at how we can divert resources to where they're most needed and what impact that has on other areas of normal business. Whether increased numbers of staff at the borders or increasing trained staff in our track, trace and test capability to deal with the increased numbers of travellers. Being able in part to safely relax the restrictions in 5B is a positive step, but one that creates challenges as we simultaneously manage the measures needed for these travel arrangements while developing the options for our next step in 5C, where, for example, at that stage would include testing upon arrival. Ultimately, we are moving in the right direction, but again, doing so carefully and safely to protect what has already been achieved. You may notice in the coming weeks that we're also working on some physical changes at our border entry points, initially at the harbour and later at the airport, things like partitions being put in place or new flows for passenger movements on foot and in cars to accommodate arrival testing. That is part of what we're doing to work up the models for what comes after Phase 5B, the 7-day isolation and testing on day 7, and as we progress to 5C. We are doing this to be prepared, but I would emphasise, even with these preparations for more unrestricted travel and putting in place physical changes being made right now, non-quarantine travel won't be introduced unless it is safe to do so. Of course, islanders will know that we've already introduced some measures by which, in specific cases, there is a need for non-quarantine travel. This has been possible. Critical workers have been able to seek permission to come into the island under certain control measures, and I can provide new figures to help quantify how many people are travelling in that way. In July, 372 applications for critical worker journeys were approved. 253 of these came under the Air and Sea Links category, with the majority of those, 221, being people who don't actually come landside. In other words, they will be pilots landing on the airfield but not coming through the airport, or staff delivering yachts where the handover takes place outside the harbour or on a designated pontoon without coming ashore. The remainder of others include fishermen who land their catch in France or in the UK without the crew leaving their vessel, and those required to maintain critical infrastructure, such as our power stations and other types of technical capability. After Air and Sea Links, the category that has been the most critical worker journey approved is unsurprisingly frontline health and care services, with 73 for the whole of July. We also introduced business tunnels recently to allow essential business meeting to take place where there needs to be a physical presence on island. So far, we have approved 24 applications for business tunnels meetings out of 35 applications received. Again, these numbers are relatively low, operating under strict control measures, and indicates industry understands is only making applications for business tunnels where they meet the essential and critical business criteria. So we are both assisting the economy and protecting our safe environment. Finally, and I'm going to take the chance once more to mention the general election. It is fast approaching. We did get quite a few of you signing on to the electoral roll after the last media briefing, where I mentioned this, and for those of you that haven't done so, you still have until August the 21st. You can also sign up for a postal vote. Whilst this doesn't prevent you going to the polling station, this is a good idea for so many different reasons. Voting from the comfort of your home is open to everyone and not just reserved for those who are resident off island, and may be particularly useful in the context of working through larger numbers of candidates given the context of island-wide voting, allowing you the time to make the most informed decision in terms of your voting. If you choose to postal vote, you just have to return your envelope which has been provided for you. Even if currently registered, you can still opt for postal voting by visiting the election website at election2020.gg and click on the postal voting tab, which is on the opening page. Clearly, island-wide voting has meant we've had to scale up the polling opportunities. There will be 4 days of polling, including the addition of 2 super polling stations. We're really grateful for the help provided by the Desains, but we're also looking for volunteers to help with polling officer duties to support during the election. So if you'd like to get involved and play a crucial role for your community, it would be greatly appreciated. You can find details again on election2020.gg.
Excellent. Thank you very much. Okay, throw it open to questions then. Who'd like to go first? Ewan.
Ewan Duncan from BBC Guernsey. Question for you, Deputy St Pierre. Thanks again for the update today and obviously letting us know that we're going to 7-day testing. In an interview a week ago today on BBC Berkshire, you actually did say that you're already looking into the idea of this testing, yet the previous press conference you said that it wouldn't be likely to be extended until the 1st of September. So my question to you would be, after all the people who've been listening to these press conferences and who've engaged so willingly with what you've been saying and waiting eagerly for new information, why weren't we in the Bailiwick the first to hear about this rather than people in Berkshire last week?
The people of the Bailiwick are the first to be informed at this press conference today after the decision was made by the Civil Contingencies Authority. We've made no secret all along that we're looking at it. The last press conference I made it very clear that there would be no decision in the next 7 days. That was the case. And we've come back to this press conference today as quickly as we could, which has just been a logistics issue in getting to today on Wednesday after the CCA met. Yes, clearly the direction of travel. We've known for some time what the options are in terms of really based on all the advice and evidence from public health in terms of where we could be putting tests into the isolation period, 5, 6, 7, 8, 9, 10 days, what the impact of all of that would be. We obviously had the trial period. So it was very clear that we were looking at it, direction of travel, and certainly there was absolutely no pre-announcement of a decision that had not been made at that stage.
I'd just add to that what I said earlier. Things have changed a lot since we had our last press conference. I mean, things have deteriorated both in the UK and further afield, and we've only got to see what's happened in Melbourne to realise that things aren't staying the same, and they won't do. So it means that we've really got to be on the ball here, making sure we know what's going on, listening to Nikki, who's doing all the work, and saying, well, I don't know, we might be able to do this and might not be able to do that. We could have held off and said, right, we're not going to do 7-day testing because we think we can move to unquarantined travel. But that clearly isn't the case now, and because of what's happening elsewhere, so it means that we could really now focus more on the 7-day testing.
I think perhaps the other thing I should add to that response in relation to the question you've asked is the context of that interview also was a radio station, Berkshire, in terms of their interest being close to Heathrow, and the national story was around possible changing testing regimes on entry into Heathrow. So it was in the context of travel-related testing regimes. So their questions were entirely pertinent in that context and talking about our own quarantine regime, which of course has applied since the 19th of March from memory. So I think you have to look at the context as a whole. Next question. Yes.
Helen Bowditch from the Guernsey Press. I understand what you're saying about how a 7-day regime is it's manageable for local people and it's sort of a compromise approach, but for the tourist industry it's not going to do anything for that industry really, because no one's going to come here for a 2-week holiday and spend the first 7 days in a hotel room. So it is quite wishy-washy in a way. Are you worried that I know you've got the business corridors, but you've only had 24 approved applications. So are you worried that you're putting out a message that Guernsey's closed for business and that you're putting the brakes on the economic recovery?
No, not at all. I mean, I think to be clear, the business channels are signalling that we are open for business. We are, yes, effectively closed for tourism, and we've known that really for some time. Really since April, May, when it was quite clear that all travel at that point would cease. And so, we have acknowledged all along, many times in these briefings, that to all intents and purposes the tourism sector is unfortunately experiencing a second winter after the last winter, and it's going to roll into the next normal winter experience anyway. And again, as we've said many times, actually, even if we threw the doors open tomorrow, the reality is yes, no doubt there would be a few more visitors, but the tourism sector is not going to recover at this stage. People's plans have changed. People are not particularly interested in travelling in the same numbers they were. So that has been part of our accepted planning and response to this, and of course that's informed our decisions around the need to continue to support the hospitality and accommodation sector through this period. So nothing really has changed in that regard.
No, and as I said when we were going through the slides, if we want to say, right, we want all tourists back, great, then we might need to bring in more non-pharmaceutical interventions. So bring back social distancing in restaurants and pubs, and think about, we might have to think about wearing masks on the buses and in shops. That's what we'd have to think about. And so where we are at the moment is saying, this is the thing. If we want to maintain what we've got on Ireland, that no restrictions that very few places elsewhere in the world have got, then we need to be very careful about what we do with the borders. And so what we've done, we've moved further. So we might move further again, depending on what's going on around us and further evidence that we have, and very much guided by what Nikki has to say.
Yeah, I think just to add to that, I think all of the decisions really since beginning of March are a series of pretty unpalatable choices, and it's seeking to make the least unpalatable choices and a series of compromises that come as a result of that in terms of the impact on life. Next question. Yes.
Serena Sandy, ITV Channel. You said that passenger numbers can't exceed the test capacity of 600 a day. How will you practically restrict that, bearing in mind that there's private aircraft and private boats as well?
Well, it's, obviously the numbers moving privately are relatively small. We've obviously got some patterns of behaviour which we will know from the records of what movements there are. Clearly the key carrier is Orkney, and obviously being states-owned, that does give us a particular relationship and ability to engage, and therefore to be able to manage the capacity. What we're really looking to do, as I said, is to ensure that we operate within a safe capacity that doesn't overwhelm the testing resources until such time as those resources are scaled up, and that is in order. Those orders have been placed and is in train, so we're in the process of building capacity. But the reality is, as I think we saw in the July trial period, the numbers didn't get close to the capacity that we had at that stage. So a 7-day isolation period still remains a significant burden. So really, people are only going to be travelling if they really feel that there is a need to do so. And I think it's in that sense it will help limit those that want to travel. You wanted to add something, Paul?
Yeah, just to add, we're working with the carriers daily to see what the numbers look like and the projection against booking, so we can understand where the peak and flow of passenger movements are. We also, I think, was made point in the formal briefing that we are stepping up our capacity, which we expect to be in place by mid-month next month. In other words, that we can handle far greater numbers should that be necessary at a time when we introduce greater travel measures. So it's only a number of weeks now before we increase our capacity.
Ewan.
In the Revive and Thrive document, you mentioned how important the air links are to this island, obviously. How much direct dialogue have you been having with Aurigny as a states-owned asset about the changes that are announced today and also future border changes and how that could affect their business and also the cost of the taxpayer at the end of the day?
Yeah, there's regular contact with them. It clearly is significant, and so it's through the States Trading Supervisory Board, we need to understand what the financial impact is because it feeds directly through to the bottom line in terms of taxpayer support. And again, that was one of the questions that's been discussed at meetings this week, is making sure that as the situation continues to evolve, we continue to be kept updated as to what the projected impact is on on Orina's financial performance. You know, there have been some positives for them in terms of particularly, of course, the Isle of Man air bridge, which has exceeded their expectations, and they've put on more capacity to do so. On the other hand, the ongoing restrictions, you know, may be projecting further than they were originally anticipated. So there is going to be an ongoing dialogue with them so that we properly understand that.
Another issue that might affect them, obviously, is the changes at Southampton Airport. You know, it's their future's in doubt because they want a runway extension, which they're waiting to see approved. You know, as a lifeline service to Southampton, are we looking at preparations that if we lose the link there, you know, in terms of hospital, that link really for lifeline services?
Yeah, absolutely. I mean, it's something that we actually considered earlier in the year when actually the resilience of Southampton was even more in doubt. And as we know from today's national story, that is back in the frame, if you like, as to its viability. So yes, undoubtedly, again, it's part of our normal contingency planning as to, you know, where else we could go in order to provide that as you described it, the lifeline link. Paul, you want to?
Yeah, I can't add much more than to say we had 4 critical airports that could service if we'd have lost Southampton, including contacts with military bases. If we really had to get emergency flights in, we were able to do so. So that has been always part of our contingency planning. But of course, I think, you know, I talked about preparedness. So we are trying to think ahead all the time. So we are looking at our virtual non-restricted flying with the additional tests put in. And so we're also meeting with the carriers so that they can start modelling all the time what that might look like and what opportunities. And of course, what we've tried to say to them and business, that we keep on putting markers in the sand, understanding from both sides that it may move, but we can edge and plan towards it. So that it is a continuous dialogue.
Yeah, I think it's an important point to emphasise that the travel operators are clearly a very important partner in this, and we need to give them as much notice as we possibly can. We're very aware of that. It's not just the public, it's not just the travelling public who want to be able to plan. It's essential that the operators can plan the capacity to deliver that. So, and again, we will give them as much notice as we possibly can, but they're very much part of the dialogue. So again, there shouldn't be any surprises for them. Aaron.
Aaron Carpenter, Bailiwick Express. You said earlier that only Group B countries will be eligible at first for the 7-day testing regime. What is the status of the UK in regards to your Group A and B lists, and also Jersey and France?
Nikki, would you mind?
So I can answer that. So we've done the initial assessments and we have given an indicative list. And we're doing England, Scotland, Wales and Northern Ireland separately, and all of those would fall into our category of less than 20 cases per 100,000. So all of those groups would classify as Group B countries at this point of time. With regard to France, the whole of France would classify as a Group B country with a alert. Within our classification of Group B countries, we're going to do regional alerts. So with a regional alert around Brittany and Saint-Malo area. And the other country that you asked about, was it just the UK and France?
I asked about Jersey. I didn't know if
Jersey would fall into a Group B country as well.
And in terms of the hotspots around the UK, similar approach.
So similar approach to the regional variations. So what we'll do is we'll look at the prevalence in the whole jurisdiction that we're looking at, but we'll also look at any regional variations. So clearly if someone's come from a lockdown area within the UK, that would then be classified as a Group A with a compulsory 2 weeks self-isolation. So what we intend doing is reviewing the countries and regions on a daily basis. We have identified the data sources that we're going to look at. We're going to be using some computer technology, some just self-evaluation of those areas. And what we'll then be doing is producing a list which we'll update on a daily basis to our communications team. And that'll then inform people. Within the Group B, we've also put a alert warning system on. So if a country or jurisdiction seems to be going in the wrong direction, what we will do is put a warning on that saying that this person for this country, for example, has gone from 18 to 19 to 20, so they look like they're travelling in the wrong direction. So it'll enable people to make that decision making when it comes to their travel. So what we want to do is what we've always done is share the data. So we just don't want to produce a list for people and say, well, there's the list. We want to say, this is the list, this is the data sources we've used, and this is what we've calculated. These are the countries that we feel are easily in the Group B. These are the countries that are in Group B, but we've just got to keep a close eye on those, and that'll hopefully enable people living in the Bailiwick to make informed decisions.
So that'd be important. People do look at the internet, look at the website, make sure that they know where their destination country, what group it's going to be in, and be aware that that's why we're putting the warning, like there's something that a country or a region that we're not happy about, so people at least forewarned where things might be.
Might be changing, yeah.
But equally, the individuals, as you said, Nikki, could find themselves, for example, if they suddenly find themselves in a new lockdown area within the UK, assuming that the UK is our main point of origin, that whilst anticipating to be originally returning from a B category area, could suddenly find themselves caught in that and subject to 14 days self-isolation.
Yeah.
So those are the risks that will need to be continued to be thought about by travellers. And there could be very little notice around that, as Nikki said, and as we've seen elsewhere.
So if there's a dramatic increase or a major outbreak, we'd obviously want to take note of that. At the end of the day, we've also got to look at the health and well-being of the whole population of the Bailiwick.
Again, sorry, before they go to the next question, we'll go to Helen next. But I think hopefully what everyone can sense around this is a much more nuanced response, which is than was possible at the beginning of this whole emergency, because of the level of information that's available, the resources which are in place, enables us to be more reactive and to enable this more flexible response that wasn't possible in February, March, April, which is why we've said that if we get a case or a cluster of cases, that does not mean we necessarily rush back to a full-scale island-wide lockdown. It will enable a more nuanced response in that sense as well. So that it should be a reassurance to the public of this constant process of contingency planning, as Paul said, enabling us to determine what the appropriate response would be for any given event. So, Helen.
I'm just a bit confused about something, because most travellers, they're going to come via the UK, a Group B country. But say if someone is coming from Spain or Portugal or USA, and they come to Guernsey via the UK, does that sort of come up? Does that somehow flag up in your system?
Yes.
Or
If they have been to that country within the last 14 days, then they will need to. They'll be considered to have been through that country. I'll have to self-isolate for 14 days.
But will the border staff know?
Yes, they'll have to do a declaration.
So you're relying on their honesty?
Paul, do you want to answer the
process?
process?
If I just can help there, I mentioned in today's notes about the building of a new IT platform. This is one of the timings we've talked about on the 14th of September, is our readiness both in our track and trace, our testing regime, but also in our technology, because the data flow for this is all essential if we to protect the community in the way that we want to keep doing. And so therefore it will capture that. So in other words, at the time of booking, we'll capture information of where the originating destination was and how it tracks back. And that's particularly important because a lot of people will hub through the UK if they are travelling in that way. So from that way, we've actually got that data flow, we can capture it, and that goes to the border staff, but also into the way we monitor staff once they've actually gone through the airport or border arrangement.
And again, false declarations would of course be an offence.
Absolutely.
So, yeah. Ewan, I think we was next.
Just a quick question about the business tunnels. Do you have information of how many people have actually specifically used the business tunnel? I think you did mention it earlier, but the amount of people, is that quantified as a success, do you think?
Well, we've had 35 applications. A number have been rejected around that. For example, we've had 10 in construction. We are publishing these numbers, but we've had 10 in construction. We had a couple of those rejected. I I think the numbers are about as expected. We thought they'd be low, and they are low in each sector. We've had 8 from Jersey, for example, 5 successful, 1 pending, a couple rejected. But I think what we're seeing is people are only utilising this facility if it's an actual essential and critical need for a particular business matter.
And I think when we announced the business tunnels, we did say that we would expect them to be, we didn't expect the numbers to be large, which is why, again, in the context of the interest of the community as a whole, we considered it to be a very manageable and an acceptable risk in the context of both the numbers, but also the protocols that have been developed by public health. Serena.
There's been 8 positive cases in Jersey in the last 2 days. Does Jersey present as much as a risk as areas of the UK like Greater Manchester or Leicester?
I haven't looked at Jersey's latest data, but previously I think they were all travel-associated cases. So I'm not sure of the latest data. So I mean, from my perspective, the answer would be no. That areas such as Greater Manchester and indeed in Leicester, when they were actually in lockdown, had significant increases in infections. So overall, I think with the 8 cases, even if you're looking at calculating the 20 per 100,000, which is the ballpark that we're saying, no more than 20 per 100,000, they would still fall below that, quite well below that, in fact. So no, I wouldn't put them in the same risk group as Greater Manchester.
But neither are they in category C, which the Isle of Man is.
Yeah.
And it's very much aligned with what we've been doing. And so we're happy to work together to create the air bridge.
And can I ask how those hotspots would work once they've been identified? So is it if you're living in those areas, then you're considered to be part of that? Or is it if you're travelling through, for example, if you travel through, say Greater Manchester goes on that list and you travel through Manchester Airport, would that still be relevant even if you don't live there?
Yeah, we'd probably have to have a fairly broad brush definition. So that's one of the pieces of work that we're going to do over the next week, is define exactly what we mean by regional variations. What we're really thinking of people resident in those areas rather than people that drove in a car through the areas. So we're going to look at criteria, and it'll be similar to our contact tracing type of criteria. We'll probably use similar types of principles, because what you're looking at is that person at risk of infection? So using the same type of definitions that we might use for contact tracing is not without logic. So we'll be looking at that and defining precise definitions for regional variations, but also for what constitutes a significant contact within that area.
Okay, Aaron, and then you, and then we'll call it a day. Aaron.
The list of Group C countries currently starts and ends with the Isle of Man. Which other places are you in discussion with? Has the Iceland link gone cold? What can you tell us about what's being discussed?
The Iceland link is not progressing at this stage. So it is, and also the Faroes. We've not actually had the dialogue with the Faroes. The Faroes actually have had an increase in the number of cases recently.
As did Iceland.
As have Iceland, yeah. All of course, I think initially travel related that have then become some community cases. Am I right?
Yeah.
Nikki. So I think it's there's no progress on either of those at this point, but we'll continue to keep an open mind as to whether there are other jurisdictions that could potentially form the same relationship.
One of the advantages of the work that we're doing at the moment is we're now actually looking at all of these countries on a daily basis. So the first group that we put on the indicative list, and I hasten to add that it is just an indicative list, it was to give everyone an idea of what we're looking at, is the groups of countries that we've looked at in detail. But as we develop, we'll include more and more countries that we look at on a daily basis.
Are there any Group B countries which are sliding towards Group C?
Sliding towards Group C, no. Not that that are actually COVID-free. So no, the Isle of Man is the only one presently that's in Group C.
It's worth noting that it is interesting that the Isle of Man has a very similar approach in lots and lots of ways to us, and I think that's probably not not least in part because of the relationship at the public health level. So they're helping to develop similar policies. But one of the areas where actually they are more restrictive than us is in relation to travel, where they basically it's only residents who are able to travel into the island. So and again, with certain exceptions, non-residents cannot move into cannot travel into the island. So they're more restrictive than we are. And that's, of course, one of the things that they need to consider. So they're in and they also are facing off against their largest area that they travel into is the northwest, which of course is experiencing their own spike. So it's they've got similar considerations to us in how they manage where they are.
But they're in a good position that they've got on-island testing as well. So they went very early for the development of on-island testing.
Ewan, final question.
Just a quick question for you, Dr. Brink. I forget where we'd come to on the topic of herd immunity. I couldn't quite remember what we'd last said about it, but is it still something that needs to be looked at, and is it a concern that we potentially won't have it on Ireland?
So I think if you look at the level of herd immunity that you require for COVID-19, if you calculate it on an RT of between 2.3 and 2.5, you're looking at probably 70% to achieve herd immunity. Now, I don't think anyone would want to expose their population naturally with 70% of the population becoming infected with COVID-19. The concept of herd immunity we are looking at again, but in the context of a vaccine. So as a vaccine becomes closer and more attainable, there have been calculations done based on the unmitigated RT, so the RT without any of the non-pharmaceutical interventions. They've looked at that, and about 70% is the calculated level that you would have to achieve herd immunity within a population. So you might say, well, why are you always going on about 90% or 95% with measles? That's because the RT of measles is between 10 and 15, so it's far more infectious. So if you have a really infectious virus like measles, you need an RT, you need a coverage of about 95%. But overall with COVID-19, if we got a coverage of about 70%, our population would probably be relatively well protected. So in the first instance, the Public Health England guidelines are that we do all of our at-risk groups as well as our over 50s because they're considered to be at risk, and our frontline health and care workers. That would be just under 50% of our population. So that's what we're looking at in the first instance.
Is that the 35,000 vaccines that you mentioned?
Yeah,
okay.
So that's calculated on our last census data, together with our number of health and care workers, together with our flu estimates for at-risk groups that we use every year. So we've used that as our model to calculate how much vaccine we think we'll need.
And if that vaccine was given to, say, 50% roughly, would that allow us to go on for quite a few months longer, or would you then look to get the rest of the 50% or 20%, as you say?
25%. I think it would depend on the availability of the vaccine and so on, and that we can only look at in the future. In the first instance, all we're trying to do is get enough vaccines for the approved groups, so to speak, in the first instance. Looking forward, yes, if the vaccine works well and so on, we'd definitely like to look at broader immunisation, but that would be a long-term rather than a short-term goal.
The constraint, presumably, on the vaccination programme and getting to that 70%, as you say, will actually be the physical availability, given that the demand across the world, the whole world is going to want this vaccine and it's going to want it quickly. So that will be the main constraint.
Yes, a lot of people can put in orders, but whether it's actually available is another matter.
Yeah, the number of vaccines, I mean, what we've already modelled is how we'd administer 35,000 vaccines in a short period of time and how we'd do it over a 4-month period. So all of that work is ongoing. But as Deputy St Pierre said, the problem is going to be getting enough of the vaccine.
Good, thank you very much indeed. I'll call it a day for today, and we will see you again at some point. Just to emphasise, we're not quite sure when that will be, but as soon as we feel we need to, we will call another meeting. Thank you so much indeed.